Thank you very much, Phil, for that introduction. And I'd just like to say a sincere thanks to the organising committee for giving me the opportunity, I suppose, to maybe present to you my own personal perspective on how I think things have evolved in children's palliative care in the last 5 years, and also to reflect on the 2009 policy, what a good, strong and firm foundation it has been for the evolving of a very dynamic and organic specialty of children's palliative care. At the outset, I need to acknowledge the commitment and energy provided by the statutory, voluntary and charitable sectors, working together in partnership both through the NDC and within their own organisations as discrete individuals or bodies in their own right. A lot of people come to the table to work with the NDC. Some people bring years of experience of frontline working with children and families. Others bring specific skills in specialist palliative care. We have engaged with parents who have experienced accessing services, the death of a child and their own bereavement. And we have also, which has been to our great fortune, organisations who have brought resources, both financially, human resources and other resources that they would have at their disposal that certainly us in the statutory sector do not have. It would seem that the myriad of organisations, and Mary has shown you the list that is there this morning, come from very different places and spaces. But the one thing I have found is that they share a deep commitment, an absolute deep commitment and a determination to ensure that children with life-limiting conditions and their families receive the type of care that they are entitled to as they journey through the most difficult time of their lives. Basically, I'm to talk to you this morning about moving from policy to implementation and how we actually did that. The National Policy for Children's Palliative Care, Children with Life-Limiting Condition with Palliative Care, was published in 2009 in December, and I'm sure all of you are very, very familiar with it. This is one I cooked earlier. For me, and for people who have commented on it, they said it's one of the strongest policy documents that we have in the country at the moment, in the health sector in the country in the moment. It was preceded by the 2005 needs assessment, which provided to us the first estimate of the numbers of children with life-limiting condition in Ireland, and at the time that was estimated at about 1,400. The policy was followed by the national needs assessment, and that highlighted the level of need for in-home and out-of-home respite services, and it also highlighted very strongly the need for full integration with disability services. We plan to publish another document in the summer, which is an external evaluation of 3 key aspects of service development: the Children's Outreach Nurse Service, the Consultant Service and the Education Programme. Prior to 2009, palliative care in Ireland was solely determined by the Department of Health report of the National Advisory Committee for Palliative Care, which was published in 2001. And that document had a very, very strong focus. In fact, its singular focus was on adult palliative care. However, the publication of the Children's Policy made it clear that children should not be considered as small adults, but they and their families have quite different experiences of life-limiting illnesses. And although needing the same palliative care approach advocated by Cicely Saunders, service development needed to reflect and meet these very specific needs. And it was out of this recognition that children's palliative care emerged as a specialty in Ireland. Compared to the UK and other larger countries, the specialty remains small in Ireland and its influence is still only growing. However, it should be remembered that although adult palliative care has been recognised as a specialty for far longer, the challenges of integration and genuine acceptance of the ability of palliative care to have a profound impact on the quality of life of children still remains a challenge among some specialties. So how did we get there? We have our wonderful policy document, so what did we do with it? The policy couldn't have come at a worse time. It was published in 2009. Ireland was in the depths of economic depression. And it really looked like the policy was going to stumble. it was going to sit on a shelf. There was a willingness, I have to say, even among adult palliative care, they recognised the need for a specific approach for children. And I think the catalyst, and people in the sector would agree, that the catalyst was the approach made by the Irish Hospice Foundation to the HSE. And the organisation committed to provide €2.25 million over a 5-year period. The money was to fund 5 of the 8 children's outreach nurses and the first paediatric consultant, and that's Mary, who's introduced herself earlier. The HSE on its own side then committed to providing the whole-time equivalent posts, and I was involved in these posts, and believe me, it was like hen's teeth trying to find WTEs at that time. There was a complete ban and moratorium on any commitment, on any recruitment, but I think it did reflect the willingness and the commitment of the HSE to try and address these needs. Since then, the HSE has agreed to take over the funding of all the posts, and 2 additional children's outreach nurses will be appointed this year. We're also working on, as Sharon has said, we're in deep discussions on the appointment of a second consultant to be based in Temple Street. In the meantime, the National Development Committee for Children's Palliative Care was established in 2010 and has already been mentioned. Its main aim was to implement the policy recommendations and to act as a point of advocacy for children's palliative care. In the last 5 years, very significant progress has been made. And I think, again, everybody has said that, and I would just like to echo that. I used to be a teacher, and I remember we were taught when I was doing my training, repeat something 3 times in 24 hours and it sticks. So we've made great progress in Ireland in the last 5 years. It is widely recognised that in order for a new innovative service to be accepted, it must be able to demonstrate that the service is safe and that it has robust governance structures in place. Therefore, one of the earliest initiatives of a subgroup of the NDC was to produce an education and governance framework for the Children's Outreach Nursing Service. This meant that although each nurse was very much bedded down within their own local hospital and community, that there was a process in place to ensure that equivalent service was being provided to children and parents, regardless of their location. Sorry, just before, I have a couple more things to say about the implementation. Shortly after the publication of the Education and Governance Framework, a national support network was established, and it's through this group that guidelines, protocols, referral procedures and pilot projects are introduced, discussed, developed and approved prior to submission to the Pediatric Clinical Care Programme. Recognising that a range of healthcare disciplines contribute to the care of children with life-limiting conditions, a 1-day course was designed and delivered by the Centre for Children's Nurse Education in Crumlin. A second, more intensive programme was subsequently developed to meet the needs of primarily but not exclusively nurses whose role brings them into regular contact with children with life-limiting conditions. Since the course has started, just under 1,000 multidisciplinary healthcare staff have completed the 1-day Level A course, and almost 120 have completed the Level B 7-day course. So we have a huge body of people working out there in the sector who have a rudimentary and an in-depth knowledge of the service. Other innovations have been piloted or going ahead, such as the Our Story Parental Record. I have them here. This is a folder that, again, was developed in collaboration by a number of organisations. Laura Lynn was involved, Jack and Jill, the Children's Outreach Nurses and the Irish Hospice Foundation. Its main aim is to ensure that all the relevant information about the child is held in a single place and reduces the need for, at times, beleaguered parents to constantly repeat the same information to the healthcare professionals looking after their child. Another piece of partnership working has led to the creation of the Children and Young People's Platform on the All-Ireland Institute of Hospice for Hospice and Palliative Care on their Palliative Hub. The hub contains information, contacts and education for parents, carers and professionals. I came to palliative care in 2011, and since then I've witnessed ongoing improvements in the collaboration across and between sectors. This is exemplified by the Palliative Care Competence Framework, which has been produced by the Adult Palliative Clinical Care Programme. The framework includes competence across 6 domains for 12 different disciplines, including nursing. And on request, children's nursing was included, and the competences are now part of the job descriptions for the 2 new children's outreach nurses currently being recruited. Challenges. There's no sector without challenges, and we're exactly the same. And I think the NDC is very, very aware of that we have done a lot of good work Other organisations, as I said, inside the NDC and outside of the NDC have done huge efforts to bring forward children's palliative care. One of the main challenges to emerge is the recognition that we were seriously underestimating the number of children with life-limiting conditions in Ireland. Using UK prevalence data, it is now estimated that instead of 1,400 children, the more likely scenario is that there are almost 4,000 children. And of these, approximately 50% will require palliative care at some stage in their illness. The implications for future service development cannot be underestimated. Another major challenge is the increasingly worried shortage of paediatric nurses, both general and specialist. And unless this can be addressed, I am concerned that the achievements and progress to date will be eroded. Thankfully, there is a new course about to launch in September. That is, again, another partnership between NUIG and UCD. And it is hoped that this will help to address some of our shortages. So where to from here? In terms of looking to the future, many of the priorities will stem from the challenges faced by the sector. The evaluation report will certainly highlight what is working, and we might need to look at how we might need to change and how we prioritise. In order to become fully integrated with acute and community services, and indeed with the new National Children's Hospital, we need to more fully articulate the value of palliative care to the lives of children and families, as well as the benefits that can accrue to the health system as a whole. The 2009 policy continues to provide the blueprint for the development of the specialty. However, it's now 7 years old, and it may well be time to carry out a full review of the recommendations and the work of the NDC with the view to ensuring that children's palliative care has the capacity to meet existing and emerging needs. We've talked about resources and integration, and you will all have in your pack this pamphlet, which is produced by the NDC. It basically will give you a good in-depth indication of what's happened, and on the back is a list of resources. And just to finish, I would like to now go into my Oscar acceptance speech. I would like to sincerely thank the NDC members, my co-chair Sharon Morrow for Laura Lynn, and the chairs and the subgroups for all their Trojan work over the years. I hope I've managed to emphasise the themes of collaboration, partnership and integration, and I would like to express my gratitude to our pioneering children's outreach nurses and consultant, to the network that supports them, to the Irish Hospice Foundation, the All Ireland Institute, Laura Lynn, Jack and Jill, Bumbulance, our academic partners, and the CNS service in Crumlin, and also not forgetting the adult palliative home care teams who so willingly continue to provide specialist palliative care to children in their own homes. It would be completely naive of me not to recognise that every organisation, including mine, has its own mission and vision, which at times translates into having its own agenda. And this may seem at times to be a negative thing, but I like to look at it as a positive thing. Because people who bring their agenda, it's usually motivated by passion and determination. It challenges the status quo. It forces us to look outside our own agenda and our own arena to build a better service for children. What is most important is for us to find our underlying common values and what motivates us and to build on these. The journey from policy implementation has been very tough at times, but it has been hugely rewarding. The bottom line for me, and I'm sure for everyone here, is to ensure that we as a specialty continue to improve as best we can the quality of life of the children in our care and to ease the burden on parents, carers and families. I hope you have an enjoyable and thought-provoking conference, and Míle Bríochas Líomh go léir.